Have you been searching for a plastic surgeon? Well, let us introduce you to Dr. Azzaam Najjaar, who's based at Melomed Tokai and discusses breast reduction.
So breast reduction is essentially a procedure that is performed where the desired outcome is to, exactly what the name suggests, to reduce the overall size and shape of the breast. With the breast reduction procedure, we achieve a volume that is more suitable for the patient. But in addition to that, we also achieve an overall aesthetically more pleasing look of the breast. So not only do we reduce the breast, we also improve on the overall aesthetic appearance of the breast. So if you find that your breasts are too big for what you'd like, and when those are accompanied with the symptoms of neck and back pain, skin changes, which is mainly infection in the inframammary fold area, which is the area just underneath the breast, as well as functional issues, especially with wardrobe and with sporting activity, go and see a plastic surgeon who can assess you and advise accordingly. But a breast reduction procedure is a procedure that will change your life. So generally how the consultation procedure works is an appointment is obviously made. I generally like to see my patients twice before the actual procedure date in order just to explain the procedure in as much detail as I can, and also to answer the patient's questions. Prior to a breast reduction, a patient needs to be marked. I generally like bringing in my patients a day before so the markings are less rushed. The markings are then assessed to make sure that they fit in, that they'll allow the breast to fit in the way it should, and the markings is essentially the blueprint for how the breast will look post-operatively. So it's a very, if not one of the most important steps of the breast reduction procedure. So welcome to theatre today. We've got a breast reduction lined up. It's a 33-year-old lady. And we're looking at procedure time between 3 and 4.5 hours. We're looking forward to making a difference in her life. In terms of the major do's and don'ts post-op, my approach is basically to advise patients to take it easy for at least a week, ideally 2 weeks post-op, with the plan to eventually attain full sort of physical functionality levels at 6 weeks onward. So the recovery period is fairly critical within that first 1 to 2 weeks. By week 6, patients are almost always back to full functional capacity, with a complete return to pre-operative capacity levels, with the advantage of having smaller breasts. If you feel that you would benefit from a breast reduction, be sure to make an appointment to see a plastic surgeon for a proper assessment. I can almost guarantee that breast reduction surgery is one of those surgeries that definitely offers an overall improvement of quality of life. Thanks for watching.